Good morning everyone. You'll be pleased to know that I'm going to continue in English. I would like to thank the organisers for inviting me to participate in ICD Granada, and I feel particularly honoured that the programme I'm going to talk about I'm doing on behalf of the Sabri Ülker Food Research Foundation and the thousands of people who've participated in the programme, and I will do my best to do it justice. So, I'm going to talk about a balanced nutrition education programme that we have implemented in schools in Turkey, which up till now has reached over 500 schools and 1 million students, their parents and teachers. But I'd like to start by giving you some parameters from Turkey in case you're not aware of the situation there. The Turkish population has been growing rapidly since the 1960s. 16 million people additional since the 1960s. In 2010 it was estimated at nearly 74 million, and by now it's about 80 million people. So it's a large population, and it's a relatively young population, which gives us a wonderful opportunity to educate people at an early stage in their life. Life expectancy, along with other developed countries, is increasing quite substantially, and as in other countries, men unfortunately are dying younger than women. And the main cause of death is cardiovascular disease, with cancer number 2, which again represents the same profile as in many developed countries. I think it's fair to say that Turkey has one of the worst diabetes records, at least in this region, and Professor Besler touched on this yesterday in his presentation. Now, the OECD lists Turkey somewhere in the middle in terms of obesity statistics, with 15% of the population obese and 45% obese, or is it 48% obese or overweight. But the latest data show that this trend is increasing alarmingly, and in the Nutrition and Health Survey, which is just due to be published very soon, the overall obesity statistics is at 30%, and women are twice as likely as men to be obese in Turkey. And the situation is even more alarming for children, where overall 7-year-olds, according to World Health Organization calculations, 24% of 7-year-olds and 24% of 8-year-olds were obese. Although the situation in the rural population is better, but at the other end of the scale there are still a significant number of people who are stunted in their growth in Turkey, 5%, 6% in the rural communities. So in terms of the nutritional status of the Turkish population, I think at the top of the list comes excessive salt consumption. I think it's legendary amongst the countries around the world that Turkey has among the highest salt intake. It's been estimated based on urinary salt excretion at 14.5 grams per day, down from 18 grams, but still approximately 3 times the World Health Organization recommendations. Iodine deficiency is also a major issue, which is decreasing rapidly, I'm happy to say, down from 27.8% of the population in 2009 to about 20% today. I've listed low fruit and vegetable consumption because this is published data from the Health at a Glance Europe OECD 2012. But I think we need to question that, because typically one would say that the Turkish diet is quite rich in fruit and vegetables. But according to the data that were published, approximately half of the population don't consume either fruit or vegetables on a daily basis. It's quite clear that low iron status is one of the key nutritional issues in Turkey, with approximately 20% of school children suffering from anemia. In terms of energy intake, if you look at the Turkish Nutrition and Health Survey, you would say that the Turkish population is eating about the right number of calories, between 1,800 and 2,500. You'd say the same in the UK and probably the same in the US. The reality must be something different, because the obesity crisis is getting worse. And what we can say is that in Turkey, there is a vast excess of calories available in the food chain for consumption. Sugar intake, which has been highlighted by the World Health Organization recently, appears not to be a particular issue in Turkey, thankfully, and dietary fibre consumption is slightly below, but not significantly below the Eurodiet recommendation. So here is the background to the situation in Turkey, and based on that background, this is saturated fat intake, which is, as elsewhere, higher than the recommended levels of 10%. Based on the situation, in 2009, the Sabri Ülker Food Research Foundation was established as a charity in Turkey in honour of the name Sabri Ülker, who was a pioneer in the food industry in Turkey and also a great philanthropist. So, in honour of his name, we've established this foundation, and I'm very pleased to be one of the Science Committee members of the foundation. And our overall objective is to improve public health by disseminating scientific information to the public using language that they can understand. And the information we use has to be based on sound, peer-reviewed science. And so, to that end, we are collaborating with many national and international organisations. We're a member of the European network of nutrition foundations, which gives us a good insight into what is going on elsewhere in Europe. And the Science Committee draws on experts from around the world, both in academia and in the food industry. And we're very pleased to have good connections with the International Life Sciences Institute and the European Food Information Council, and their chief executives both sit on our Science Committee. We have three pillars in our foundation. That's the simplest way to describe it. The first one is education. So we're encouraging people to adopt a healthy lifestyle by promoting healthy eating, a balanced diet, and a high level of physical activity. The second pillar is research. So we are encouraging, supporting, and commissioning research in the area of food and nutrition. And the third pillar of our foundation is communication. And we have a very active and well-accessed website providing information on various nutritional issues from a variety of sources. We collaborate with many groups around the world, and I think I'd particularly like to highlight the Harvard Medical School, with whom we had a joint nutrition summit earlier this year, which was voted as the #1 conference in Turkey. And we're working with the British Nutrition Foundation to develop programs. So, in terms of education, we felt that getting in early was the right thing to do. So we, in 2011, initiated program of education in schools in Turkey with the objective of instilling healthy eating practices and to encourage physical activity. And in contrast to the speaker in the plenary session yesterday, our mantra has been that you can eat anything you like, provided you establish a balance. And that is the key learning. And that people in different areas are not all going to eat the same thing. We're all going to eat different diets depending on what is locally available. This program has been implemented with the collaboration of the Ministry of Education in Turkey, and especially with the work of Hacettepe University in Ankara and other universities around the country. So this has been a top-down program of education. We have something like 8,600 teachers trained in the program. We've trained the trainers, we've trained the school officials, we've trained the teachers, and then we have the students. And this program is not a short-term thing. This is a 32-week program of nutrition education for 2nd, 3rd and 4th graders. So that's for the children aged from 7 to 9. And it's 2 hours a week. 1 hour a week is specifically focused on this program, and the other is more general, localized nutrition education from the teachers. So here we see the spread of, we call them pilot areas. We haven't reached the whole of Turkey, but we've reached over 1 million students. And the program has a number of materials which are designed to appeal to the students and make things interesting for them. We've teamed up with Warner Brothers, we've developed brochures, films, lesson plans, and all the information about the program isn't only available for the specific schools that have been targeted, but it's available on the Ministry of Education website, and also, of course, our own website. So it's freely available to all teachers in Turkey. But people say to us, well, how do you know it's been successful or useful? How have you monitored whether the program has made any difference? And it's really behaviour change that we are trying to target with this program. So we have enlisted the support of 3 of the most important universities in Turkey, in Istanbul, Kayseri and Izmir, to monitor the eating and exercise habits of the students before and after this 32-week intervention. And I would particularly like to thank the professors and their students who have been involved in this. So I have 5 minutes left, which should be enough to present some of the results. So we've gathered all the data in statistically sound methods, and the idea was to look at the consumption trends before and after the intervention, and it involved interviews, firstly with the parents, then interviews at the schools. The parents filled up nutrition consumption frequency forms, and then the forms were entered into statistical packages, coded and analysed. In this program we interviewed 618 students, roughly equally between the different areas, roughly equally between males and females, and roughly equally between the different grades that we were targeting. And this is the key slide here. The results have shown that the energy intake very significantly decreased, both in the males and the females. So from 1928 to 1761 kilocalories per day in males, and 1847 to 1706 in females. And that is a very robust, statistically significant result. The other area I would like to particularly draw your attention to is the physical activity level values, which are calculated relative to the basal metabolic rate. And 1.88, which is the higher rate for the males after the intervention, represents a high level of physical activity, as does the 1.84 for females. So we very significantly increased the level of physical activity among the students. When you delve into the individual macronutrient intakes, the situation is less clear. And in line with the Turkish population, the fat intake is still worryingly high. Carbohydrate intake is lower than we would actually like. Protein intake is more or less at the right level. So we still have some work to do, but this program is ongoing, and the programming is continuously being adapted based on the results and the feedback. But the adoption of the program by the schools, by the students, and especially by the parents has been outstanding. The parents now feel that they're being educated by 7 to 9-year-olds, which is perhaps the way it should be. The weight of the students has not decreased, but their weight relative to the World Health Organization standards has decreased. So don't think that people have gone from 68 to 66 kilos. They've gone from the 68th percentile to the 66th percentile. So this is a step in the right direction. And their body mass index is similarly improved. So I think just to summarise the results, the students' total energy intakes have decreased, their physical activity levels have increased, and the age-based BMI levels have dropped, but just really for the female students in a significant way. So the frequency of obesity, which as we saw at the beginning is a huge issue in Turkey for children, has decreased with all the students. So for the future, we intend to extend this program also to preschoolers, and we're currently developing the program in collaboration with the Ministry of Education to target the first grade students, preschoolers, and implement it throughout Turkey. We are continually going to monitor the progress of the program and its success or otherwise, and adapt it according to where the issues still remain. But we must focus on reducing sugar, salt and fat intake and increasing fruit and vegetable intake. I mean, Turkey is the 7th largest agricultural economy in the world and exports 50% of its food production. So we have a lot of opportunity for fruit and vegetable consumption. I would like to thank again the Sabri Food Research Foundation and all my colleagues who've worked on this program, the Turkish Ministry of Education, but particularly the professors and the students from the 3 universities who've coordinated this assessment of the value of the program. This has been a huge undertaking and done in a very professional way. So thank you very much.